Welcome very much to this webinar on mortality statistics. I'm Dina Leadbeater. I chair the Health Stats User Group, so welcome to everybody, and thanks to the speakers for willing to contribute to this. This is organised by Health Stats User Group in collaboration with Royal Statistical Society Official Stats Section, so we're very grateful to the RSS for providing the hosting facilities for this webinar. So we can have the next slide, please. Just a bit of the usual housekeeping. Those people that have attended these webinars before will be familiar with this. We ask you to put questions and comments in the chat, which makes it easier to see for the speakers to answer afterwards. We run through all the presentations first and then have a Q&A at the end, because sometimes the questions may be relevant for more than one speaker. And then that's all captured in the final report at the end. If you've got any problems with that, you can always email us at the webmaster address that's on there. This session is being recorded, and the recording will be available on the RSS YouTube, usually a few weeks after. It takes a while to sort that out, but the presentations will be posted immediately afterwards, and there will be a report a week or so after the webinar. These will be posted in two places. They will be posted on the Stats User Network and also on the Analyst X community that Health Stats User Group has within Future NHS. We'll give a bit of information at the end to make sure you know how to find those, but if not, you can always email the webmaster address that's on the slide now. I have to make sure, in the usual, to ask everyone to keep themselves muted during the presentations. And also thanks in advance, because David is actually taking the role of actually moving the slides through. So, he's our first speaker as well. So, if we can move to the next slide, David. So we have speakers. This is representing mortality statistics across the UK. So David will start off talking about England, the situation in England and Wales. Then after David, Beth Watson from National Records of Scotland will talk on Scotland data. And then we have Rachel Giffen and Suzanne Toll, who will talk about Northern Ireland data. So I said we'll run through the speakers one after the other, and then we'll take the Q&A at the end. So I think that's enough from me, and hand over to the important bit, which is the speakers, and over to you, David.
Thank you. Yeah, just to introduce myself, I'm David Mays from the ONS. I lead the Mortality Statistics team. I'm going to talk to you today about what we do at ONS on mortality statistics, which we cover England and Wales. So I'll say a bit about what we publish and some of the development work that we're doing, as well as talking about some of the work we're doing on the comparability of mortality statistics across the UK as well. So I'll start by talking through what we publish on mortality in the ONS. So as I said, we cover mortality in England and Wales. We publish regular statistics on lots of different topics. So excess mortality, which is published weekly. We publish death registration statistics weekly, monthly and annually. We also cover lots of cause-specific releases. So the big topics we cover are suicides, which is published quarterly and annually, drug poisoning deaths and alcohol-specific deaths, which are published annually as well. We also publish child and infant mortality annually, and also deaths of homeless people, and also figures on life expectancy, which is obviously related to mortality. Just to say a bit about the data that we use. So all of our outputs on mortality that are published by ONS are based on death registration data in England and Wales. And yeah, under the Births and Deaths Registration Act, it's a legal requirement for deaths to be registered. So yeah, all deaths will be registered in England and Wales through the local registration service in partnership with the General Register Office. And all of that data comes into the ONS and is coded to causes of death according to the World Health Organization International Classification of Diseases. And this is done to agreed international rules, which makes our mortality data comparable both to what Scotland and Northern Ireland publish, but also internationally. And I should have said as well, all of our data covers deaths that occur in England and Wales. So any deaths to England and Wales residents outside of England and Wales won't be captured. And we also will capture some deaths of non-England and Wales residents that occur within England and Wales. And most of our statistics on mortality are based on when the death was registered rather than when the death occurred. But you'll see later in my slides, we are looking at changing that approach going forward. I'll say a bit about some of the regular releases that we publish. So our most frequent release is the weekly death statistics. So these are provisional figures on deaths registered by week. So we've actually changed the way we present these statistics recently. So we've now moved to a dashboard format for our weekly death statistics, which is essentially a move away from text-based commentary to more visual commentary and charts. So this is kind of what it looks like. We have like big numbers displayed to show the key messages and some simplified charts within there. And then there is kind of layering of the information with what's called accordions. So these are kind of expandable bits of text for the user, which means they can dip in and out of those pieces of information to meet their needs. And then there is links to the more detailed methodology and user information if required. And so far, we've had some good feedback on our new approach to presenting our weekly death statistics. We also publish monthly death statistics. Again, these are provisional death registration statistics by month. They're quite timely as well, so we tend to publish figures for the previous month about 2 weeks after that month. So we will be publishing, for example, monthly deaths for November 2025 will get published the middle of next week. And then in terms of our annual releases, so once the death registration data is final, we publish 2 releases of that information. So that the first one is usually in April or May, which is death registration figures for the previous year. And these are just the raw numbers because we don't have the population data available at that point in time. And that's the reason we do a second publication, which usually comes in September or October time. And this includes the population data and enables us to produce the mortality rates. So at the moment, the latest data we've got published for our annual deaths is for deaths registered in 2024 in England and Wales. I mentioned suicides. So suicides is one of our biggest topic areas that we cover. We get a lot of interest in these statistics when we publish. We usually publish our annual suicide statistics in August or September each year as well. So our most recent release is of 2024 suicide registrations. We also publish quarterly suicide statistics. Again, these are provisional statistics which are published for England only. Increasingly as well for suicides, we're doing lots more new analysis where we usually link our death registration data to another source, which helps us draw new insights. A recent piece we did was on suicides in higher education students, which was published a couple of months ago, and that is based on linking our deaf registration data to data from the Higher Education Statistics Agency student records. So yeah, increasingly doing lots of new analysis in the suicide space as well. Another important area we cover is drug poisoning deaths. So again, these get a lot of interest. We publish these statistics annually as well, at a similar time really to the suicide statistics. So the most recent release went out in October this year, related to 2024 registrations. We do a lot of analysis as well on drug poisoning deaths, which often goes to the Advisory Council on the Misuse of Drugs. We're also doing some improvement work on these statistics to try and improve the information that we publish on substances involved in these deaths. And we've been working with OHID to gather toxicology data to improve our substance information as well. And we also cover alcohol-specific deaths. Again, these get a lot of media attention, particularly in the last few years where we have seen an increase in these types of deaths. We only cover in this release deaths that are a direct consequence of alcohol. And there are, separate statistics that do cover the broader definition of alcohol deaths and other related conditions that can be related to alcohol. But yeah, the ONS figures for England and Wales are only alcohol-specific deaths. I mentioned I'd talk a bit about the improvement work that we're doing. So one of the limitations with the ONS data that we get is that we only know about deaths once they've been registered, and there are a lot of deaths that will go to a coroner, and we don't know about them until the inquest takes place and the death is registered. And this really creates a reporting problem for the ONS because we can't really produce timely figures on death occurrences because of that issue. So what we've done in the past really is publish all of our statistics on a registration basis, which I think has been okay historically, but what we have noticed is that registration delay, so the gap between when the death occurs and when it's registered, has increased over the last few years for some of the big causes of death we're interested in, like suicide and drug deaths. And that does mean now we're in a position where we can't be sure that the trend we're seeing in death registrations and occurrences is aligning for some of these causes. And yeah, there's a good example here in the slide. So for suicides registered in 2023, for example, in England and Wales, actually only 39% of these deaths occurred in 2023 as well. So that means, there is that challenge, as I was saying, between trends in occurrences and registrations aligning. So what can we do about this? So there's a few things. So one thing we've tried to do is improve how we communicate our mortality statistics to make it clearer, because there has been issues in the past where users, I think, haven't really appreciated that we're publishing based on when the death is registered rather than when it's occurred. We're also considering trying to switch our mortality statistics to be occurrence-based instead. And we're also exploring new sources of data that might be able to give us more timely information on mortality. So I'll say a bit more about some of this in the next few slides. So the first one's improved communication. So as I said, historically, all of our releases have been based on registrations, but we have made some changes for the latest releases and introduced more commentary on occurrences. So we did this quite well for our latest suicide statistics release, where we introduced more commentary on suicide occurrences into the main points and into the release. And you can see in the chart here, we've included suicide occurrences, and it actually shows that when you look at occurrences instead of registration, suicides have been fairly stable since about 2018, and that's not, mirrored when you look at registration. So that is, telling a more complete story on suicides in England and Wales. We're also looking to try and switch to publishing more occurrence-based statistics. This is going to be a challenge for some of the causes I mentioned, like suicides and drug deaths, because we have long registration delays, which would mean, to put out an accurate occurrence figure for suicides and drug deaths using our data, we would have to wait a long time for all of those deaths to be registered. So one thing we are looking at is whether we can do some modeling or nowcasting to try and account for the registration delays and produce more timely estimates of occurrences for some of these causes of death. So that's going to be one of our big development pieces of work that will move forward in the new year, and will be included in lots of the releases I mentioned earlier when we publish them next year. And then we did launch quite a big consultation on our suicide statistics earlier this year. So that was launched in April. We wanted feedback really on how we presented our statistics on suicides, with a particular focus on how we present registrations and occurrences. We got a really good response on this, so 92 responses from stakeholders. What we did, we asked them for their thoughts on 3 different options on how we present suicide statistics. The first option was essentially not making any changes to how we present our statistics and still focusing on suicide registrations. But we did give a second option to present both registration and suicide occurrence data in our releases. And then the third option was really to move to publishing based on an occurrence basis only. So those were the 3 options. And the most popular option was that option 2, which would be presenting both registration-based and occurrence-based suicide statistics. And we did actually move towards that model for our most recent annual suicides release. And the feedback we did get from stakeholders on that was very positive. So that was really good. I mentioned new sources of data. We are supporting OHID on a couple of new sources of data related to suicides and drug deaths. So the first one's on real-time suspected suicide data. So this data is now being gathered from police forces in England and in Wales. And this offers the chance to report more timely figures on suicides. We're working very closely with OHID to try and improve the quality of the data they're getting from police forces, and also try to establish this as a designated, accredited official statistic. At the moment, it's an official statistic in development, but it doesn't have the same timeliness issues as the ONS death registration data, and potentially it can detect trends in suicides more quickly than the ONS data can. And then also in OHID, I mentioned the toxicology data. So OHID are gathering toxicology reports from tox labs on drug deaths now, and they are starting to report that information in a new dashboard. So this really acts as an early warning system for OHID to detect deaths involving new substances that might be coming in, and it enables them to respond quicker than they would be able to using the ONS data. But also what we want to do is link the ONS death registration data to this toxicology data to help improve the information that is on deaths involving different substances as part of the drug deaths release. So that's an improvement piece of work we're taking forward as well. And then the last bit I wanted to mention is about the cross-government mortality theme group that the ONS run. So this is quite a useful group. It brings together producers of mortality statistics across the UK. Lots of organisations involved, which are listed in the slide. This is a useful group really for finding out about what's happening on mortality statistics across government, sharing knowledge and best practice, and it also helps us coordinate our publications across the UK, for example. And one thing we are trying to do as part of this group is work towards improving the information that we're giving to users on how comparable mortality statistics are across the UK. And we have done some good work between ONS, NISRA and NRS on this. So a couple of years ago, we did put a blog out about the comparability of drug death statistics across the UK. And that is a really useful resource now where we signpost users to that from bulletins. So whenever we publish ONS drug death statistics, for example, we put a link to the blog, which enables users to understand the comparability of the England and Wales ONS data to what is published by NRS and NISRA for Scotland and Northern Ireland, respectively. We also now include specific sections in ONS bulletins on how comparable the statistics are to the Northern Ireland and Scotland data. And the example in the slide is what we include for suicides. And again, that's useful for users who might be interested in, how comparable the England and Wales data is to Scotland and Northern Ireland. And we've also got some other developments that we're working on through the mortality theme group. So we are working on a short explainer on the weekly death statistics and how comparable they are across the UK as well. And we're hoping to publish that early in the new year, again, as a resource for users to go to who are interested in that comparability. But that's all I wanted to say on the ONS England and Wales statistics. I'm now going to hand over to Beth, who is going to cover NRS and what happens in Scotland. So over to you, Beth.
Yes, thank you, David. And also note we've got some really good questions coming in the chat, so we can come back to those at the end in the Q&A session. So Beth, over to you. Yeah.
Thank you. So I work in the Vital Event Statistics team within National Records of Scotland, or NRS as we're often known. Next slide, please, David. So I'll just give a bit of background about the role of NRS to start with. We're responsible for the civil registration function within Scotland, as well as producing statistics based on those registrations. So slightly different to other parts of the UK where the registration is carried out by the General Register Office and then statistics are produced by ONS and NISRA. Deaths are registered with the local registrars across Scotland, and that information then feeds directly to us. And deaths which occur in Scotland should be registered within 8 days from the date of death as well. Next slide, please. So just a bit more background, this time on the kind of basis of our statistics. So once the death record comes into our system, the cause of death will be coded according to ICD-10, as David mentioned. We use software to automatically assign those codes, and then every record in Scotland is reviewed by one of our medical coding team just to ensure that the codes have been assigned correctly, and any that kind of need a bit of manual review as well. A person might have multiple causes that have contributed to the death, but there will always be only one underlying cause, and that is the basis for most of our statistics unless we sort of state otherwise. Similar to England and Wales, our statistics cover every death which occurred within Scotland, and that includes non-residents as well. And also most of our statistics are based on the date of registration rather than the date of death, again, unless we say otherwise. Next slide, please. So similarly, we have provisional statistics throughout the year. So these are our weekly and monthly deaths, and we also do a quarterly report on births, deaths and other vital events, which includes a lot of mortality data. Next slide. So I'll start with our weekly deaths. These are published every Thursday morning, and this is a data-only release. They are based on the date of registration, with the exception of one table which looks at daily data by date of registration and date of occurrence. These include various breakdowns by different things, so geography, location of death, things like hospital and care homes, and excess deaths as well. And we've also recently moved our flu deaths to combine them with this tables, and we've recently added a breakdown of flu deaths by age group, with kind of interest in flu deaths at the moment as well. Next slide, please. So when it comes to comparisons with other parts of the UK, we obviously produce a lot of similar statistics, but there are some differences, and these are maybe more obvious within our weekly death statistics. So as mentioned, in Scotland, deaths should be registered within 8 days of occurring, whereas that's 5 days in other parts of the UK. In practice, the lag from date of death to registration is on average 4 days at the moment in Scotland, but that's obviously sort of changed throughout the years. We measure a statistical week as a Monday to Sunday, so that's the ISO standard weeks, and then the data is then published on the following Thursday. So we've got a lag of about 4 days from the week ending Sunday to when we publish. And again, that's slightly different in other parts of the UK. Another of the differences is the role of medical reviewers and medical examiners. So in Scotland, we have medical reviewers who check a random sample of death certificates. It's around 12% of records are checked. And that means that the registration is delayed until that review has been completed. And in England and Wales, the medical examiners review every death certificate, which can then result in sort of uniform delays across all of England and Wales. Next slide, please. We've got our monthly statistics. This is another one of our routine ones. These are published on the last Thursday of each month, and they cover the previous month. And again, this is a data-only release as well. So as David mentioned, ONS published their monthly data based on date of registration, and we are slightly different in that we cover both date of registration and date of occurrence in Scotland in our monthly data. Next slide, please. So our quarterly, this is our final kind of provisional data we have throughout the year. It's published on the second Tuesday in March, June, September and December for the previous quarter. And yeah, it covers births, deaths and other vital events. And this is probably the first time throughout the year where we publish quite detailed cause of death information. It is provisional, but it kind of gives a good idea of what the trends are in advance of our final data for the whole annual year. Next slide, please. So that's all of our provisional data, and then each summer we finalise our death registrations for the previous calendar year. For a lot of deaths, the cause is known and then they can be registered quite shortly after the death occurs. But as David mentioned, some deaths are referred to the coroner in England and Wales, and the equivalent in Scotland is the procurator fiscal. The slight difference we have is that deaths that are referred to the procurator fiscal are often given an interim cause of death, and that means that the death can be registered quite shortly after it happens with its interim cause, and then the procurator fiscal will provide us with an updated cause of death once they've completed their investigations. So quite often we'll see this for a drug death, for example, might be registered with the interim cause of unascertained pending toxicology results, and then the procurator fiscal will later give us an update, and it might be multi-drug toxicity, for example. We aim to get all of those updated cause of deaths in before we finalise our data for the year. So that means the sort of time lag we have between death and date of death and date of registration is sort of not as long in our statistics. And I will come back on to the data received from pathologists a bit later on. Next slide, please. So these are our annual statistics. We publish most of them shortly after we've finalised the data for the year, and I'll cover a couple of them in the next few slides. You'll see we publish a lot of the kind of same annual publications as ONS and ISRA as well. Next slide, please. So our first big annual release of data is our vital events reference tables. Similar to our quarterly report, they cover the kind of whole range of vital events topics, but there is a whole section on deaths and a whole section on causes of death. I've just highlighted some of the kind of information that's available in this release. So lots of different demographic breakdowns, things like the deceased country of birth and occupation. And then we also have our really detailed cause of death information. So this includes some specific causes, so things like accidental deaths, road traffic accidents, and deaths from poisoning as well. And that leads me quite nicely onto the next slide. So our drug deaths publication is usually the first one after we've published all our annual tables. This is one of, if not probably our most high profile statistics that we publish. They gather a huge amount of media attention, often in the kind of hundreds of reports shortly after we publish, and they're often looking at kind of comparisons of Scotland compared with the rest of the UK or Europe in that example from the BBC. We publish a lot of data in this release, so we've got 3 different definitions of a drug-related death that are, there's data on. And we're very fortunate in Scotland that we receive detailed information on the drugs involved in deaths directly from pathologists. So we have a very detailed database on this information, and we publish a lot of different breakdowns of the drugs involved as well. And that information is really important in identifying deaths that meet the headline definition, which is called drug misuse deaths, which relies on knowing whether a controlled drug was present in the death. So this is a really good example where we use broadly the same definition across the UK in how we define drug misuse deaths. But there are differences in the underlying data, and like David mentioned, there's the blog on kind of coherence of drug death statistics, and it goes into more detail about why we use a slightly wider definition, which is called drug poisoning deaths, when we're making comparisons across the UK. And we're really clear about that in our reporting, where we're using different definitions, and particularly when we're reporting or making any comparisons, we're always highlighting that we're using a different definition there. Next slide, please. So our drug deaths is a really good example where NRS are not the only producers of mortality statistics in Scotland. Public Health Scotland are responsible for the National Drug-Related Deaths Database. So this takes the same information that we use in our NRS statistics, and then they collect a whole range of information about those deaths as well. So it covers things like living arrangements and whether the people were using prescription drugs and lots of different information about them. Because they're obviously collecting all that information, there's a bit of a lag, usually about 1 or 2 years behind the latest year that has been reported in the NRS data. So we've recently published the 2024 data this autumn, and then Public Health Scotland will publish their update on the National Drug-Related Deaths database, I think at the start of next year, and that covers 2022 and 2023. They also publish the Rapid Action Drug Alerts and Response, or also known as RADAR. So this is a report that brings together information about drug-related harms, service usage, and some toxicology data. So it's a really early insight into what's going on with some of the drug trends, particularly if there's any drugs that are of concern, and yeah, the toxicology data gives a bit of an idea of what's going on with deaths as well. And then the Scottish Government also publish some quarterly data. So this is their suspected drug deaths in Scotland. This uses management information from Police Scotland. Again, it's a different basis to the NRS statistics, but it can give quite a good indication of what's going on. Certainly trends-wise, you can see quite early on whether we're expecting kind of deaths to go up or down, for example. And then finally, the Scottish Government also recently have started publishing deaths in prison custody. This is an annual report that's looking at causes of death in prison custody that we've provided the data for, and that includes looking at drug deaths as well. And they're hoping to include some more detailed information about the drugs involved in their next release as well, and that's coming from the information that we hold. Next slide, please. Just finally, another publication that's worth mentioning is our probable suicides. So this is another example where the statistics cover similar definitions, but there's slight differences depending on who's using the data. So Public Health Scotland hold the Scottish Suicide Information Database, and that includes most of the same deaths that we include in our probable suicides, but for example, they remove non-residents from the data set, so it's slightly different, but again, they're quite clear about where the differences are. And their reporting tends to have a particular focus on things like contact with health services prior to the death as well. And next slide, please. So I'll just end there. I'm just going to point out we are hoping to do a review of some of our statistics in the new year. So I really encourage anyone with interest in mortality statistics for Scotland, particularly, to sign up to the ScotStat mailing list that there's a link to. And we come under the heading of demography. And so if there's any updates about our statistics or, as I say, a review potentially, then that will be sent out to anyone on that mailing list as well. And that's me.
Great, thanks very much, Beth. And obviously, if you're looking for feedback, we can obviously post things on the websites to encourage people to respond through that route as well. So thank you. Well, we'll now move on to the situation in Northern Ireland, and we have Rachel and Suzanne. I don't know if you're both talking or double-handed. I'll leave it over to you.
Thank you. Good afternoon, everyone. My name's Rachel Giffen, and along with my colleague Suzanne Toll, we work in the Vital Statistics unit for NISRA. So today we will be discussing our mortality publications in Northern Ireland, and we'll be including comparability with ONS and NRS, and then the steps that we've made to improve coherence. Next slide, please. So just a wee background, we produce death statistics based on death registration information that is collected by the General Register Office of those whose death occurred in Northern Ireland. So like NRS and ONS, there will be non-Northern Ireland residents included. Death statistics are produced on a weekly, monthly, quarterly basis, and these are provisional. And then they're also produced on an annual basis using final data, as well as being produced for ad hoc query user requests. Next slide, please. So deaths occurring in Northern Ireland are registered on the Northern Ireland Registration Office system. And in the Vital Statistics unit, we process daily extracts of these registration records. It's important to note that published figures relate to only the deaths which occurred in Northern Ireland. Just to reiterate that, so deaths of those whose usual address is outside of Northern Ireland and excluding deaths of usual residents where the death occurred outside of Northern Ireland. Next slide, please. So NISRA produce regular mortality publications on a weekly, monthly and quarterly basis, as well as several annual publications. As in addition to the Registrar General Annual Report, we produce annual statistics on suicide deaths, winter mortality, alcohol-specific deaths and drug-related deaths, and more recently, deaths of homeless people in Northern Ireland. I'll go into a few of these publications in more depth here in the next slide. Next slide, please. So we publish weekly death registrations in Northern Ireland every Friday morning at 9:30. Tables 1 to 5 of our weekly death registrations are based on death registrations, and Table 6 is the only table that we produce on a weekly basis that are death occurrence. Most are based on registrations to account for the delays in registration which occur for several reasons. For example, an eligible doctor must certify the cause of death. If the cause of death is unclear, for example, this can cause delays. Delays can also occur if the death is referred to a coroner, for example, due to inquests or the need for postmortems. In Northern Ireland, around 1 in every 4 deaths are referred to a coroner. Another reason for delays can be the reliance on relatives of the deceased to register the death, And finally, delays can occur when registration offices are closed on bank holidays. You can find out more about these processes in the time taken to register deaths in Northern Ireland report, which we published on the 20th of November. Next slide, please. So when assessing the comparability of our mortality publications, such as weekly death publications with the rest of the UK, so NRS and ONS, there's a few similarities and differences that we have to consider. So firstly, like England and Wales, in Northern Ireland, deaths should be registered within 5 days of the death occurring. But as previously discussed, there can be delays, but this is the statutory deadline. A notable difference in Northern Ireland is our bank holidays, where we're closed. So on the 17th of March for St. Patrick's Day, and the 12th of July for the Battle of the Boyne. So for weekly publications covering these weeks, direct comparisons with the rest of the UK, it can be challenging. Next slide, please. Additionally, like Scotland, Northern Ireland, the certifying doctor must have attended the patient during their last illness. But however, in Northern Ireland, there is a time limit. With deaths being referred to the coroner if the doctor hasn't seen the patient within 28 days prior to the death or after death. In terms of the statistical week, like England and Wales, our statistical week is Saturday to Friday, and Northern Ireland reports 7 days after the week ending day. So for deaths registered in week ending, for example, Friday the 21st of November, our report will be published on Friday the 28th of November. Next slide, please. Another key difference in relation to our cause of death totals, any cause of death related total in Northern Ireland for our weeklies are based on keyword searches, because ICD codes are not available as frequent for us as the rest of the UK. NISRA has an arrangement with the ONS coding team for them to code Northern Ireland deaths, which are done on a monthly basis. So this means that Northern Ireland data on COVID-related deaths or flu and pneumonia-related deaths in our weekly tables are based on keyword searches of the cause of death fields on their death certificate. However, we do revise our weekly tables on a quarterly basis, and a part of this revision is to replace the word search based cause of death with the totals that the ICD codes have came back with. However, we've found minimal difference, so we're confident and can stand behind the keyword searches that return the figure with a high level of accuracy. Next slide, please.
Thanks, Rachel. So continuing on, our weekly deaths publication contains 7 tables, as mentioned, ranging from table 1A to table 6, with tables 1A to 5 covering death registrations and table 6 covering occurrence data. And the occurrence data, as mentioned, is published as secondary non-headline statistics. Next slide, please. So next, our monthly publications are published approximately on the 11th of the month, or the closest working day for the previous month. So for example, this morning we published November data, and regarding mortality related data, we publish provisional statistics of registered and occurred deaths and registered stillbirths. Next slide, please. Next, we have our quarterly publications, which are released approximately 8 to 12 weeks after the end of the quarter. Our latest release was the Registrar General Quarterly Report for Q2 2025, which was published on the 25th of September. And Q3 2025 will be released in the new year. Our publication schedule will be updated with the exact date soon, and you can keep up to date with all of our upcoming releases there. So the quarterly publication also provides provisional statistics of deaths, stillbirths and infant deaths. It includes both top-level underlying cause of death and detailed cause of death by age and sex, along with death rates, age-specific death rates, 3-year averages of suicides, alcohol and drug-related deaths, Health and Social Care Trust and local government district breakdowns, and excess and expected deaths. Next slide, please. So finally, we have several annual publications that include mortality data. Our annual report of the Registrar General for 2024, along with our annual suicide deaths report, were both published on the 20th of November 2025. So our annual report covers data on deaths, cause of death, stillbirths and infant deaths. There are 22 tables on deaths data, providing more detailed breakdowns of age, geographical location, month of registration, death rates, etc. In relation to cause of death, there are 15 tables going into more detailed cause of death by ICD-10 code and providing breakdowns on leading cause of death. And finally, there are 10 tables on stillbirths and infant deaths, providing numbers and rates and breakdowns of geographical location, and also numbers and rates of perinatal, neonatal, and post-neonatal figures. Other annual publications coming in the new year include winter mortality, alcohol deaths, and drug-related deaths. And for the first time, just this morning, we published a report and tables on deaths of homeless people in Northern Ireland. Next slide, please. So this publication has been in development for the last few years, where we have been working in collaboration with the Northern Ireland Housing Executive and with NRS, who have been part of the production team for this first publication. These statistics are classified as official statistics in development, as they will continue to evolve. And this was developed to improve comparability with other UK regions, so therefore the methodology of capture recapture was used. However, there are a few differences in the methodology, where we were unable to utilise all of the search strategies used by ONS at NRS, for example. But you can find out more about these differences in the reports and tables, along with the methodology paper, all published this morning. Next slide, please. So another effort to improve coherence is the introduction of MCCDs, which are medical certificates of cause of death. So this additional quality assurance process further enhances the quality of death data, in particularly the cause of death information flowing into the NI registration system and with our death statistics. So initial findings so far have indicated that it can be completed in a timely manner. Next slide, please. So developments like these, along with other news about our publications, are discussed during the mortality theme working group, as mentioned by both David and Beth. Additionally, a working group was set up for excess deaths to develop a change in methodology, and NISR published some information papers around this change, also linked here. Next slide, please. So, thank you very much for listening. We'll aim to answer any questions you may have today, but please feel free to contact our demography inbox with any queries relating to these statistical outputs, or our information inbox with any general information requests. Thank you.
Thanks very much both, and thanks to all the speakers. We're now going to move on to the Q&A session. Can we just have the final slide, please? Because that's just a notice to where. Right, so just to say that we will be posting all the material on both of these websites. If you have a problem, then contact HSUG. But if we can actually now stop sharing the slides so that we can bring the speakers on and we can get on to the Q&A session. I think that'll be easier for David if he's stopping sharing his slides. We've got a whole range of very interesting questions we'd like to address in the time we have available. Just to say that if we don't actually manage to respond to everything in the Q&A session, then the speakers, we will be sharing the questions with the speakers, and then they have an opportunity to respond, and that will be included in the final report. So we'll try and get through as much as possible, but if there are other questions, feel free to comment afterwards, and the speakers will have an opportunity to comment in writing. So looking at the range of questions, maybe we come on to some of the more general ones first. There are some very specific ones as well. And if any of the speakers can see those and answer the specific ones in the chat, then that's obviously helpful. But I mean, a theme underlying quite a lot of the presentations and the questions is this whole issue about the delays in registration and what can be done or is being done to improve the situation. I know, I mean, all speakers addressed that, but the issue of being able to get the fact of death on and then some kind of interim or provisional cause of death, so at least you've got some information. But obviously this causes a considerable issue in terms of the statistics and the interpretation of that. So I would like, I mean, coming back to the speakers, thoughts on what can be done or is being done to try and improve that situation. David, what is ONS's role in terms of trying to improve the timeliness of registration?
So I think if we were building a system from scratch, we would follow what's happening in Scotland, where you obviously know about deaths and get an interim cause before the inquest happens and the final registration takes place. But we don't have that obviously in England and Wales, and it's very difficult for us in the ONS as really secondary users of the data to make a change to a system that's been in place for a long time. So what we're left with really, I think, is the reality is we're not going to be able to change the system in place and move to something like what Scotland have. So what we need to do is try and move forward some of the improvement pieces of work that I mentioned in my presentation. So the work we're doing on nowcasting, so being able to estimate occurrence data to account for the registration delays is something we're working at. There's well-known techniques used elsewhere in government that we're looking to use there. So I think that's important. There's the new data sources that I mentioned. So, on suicides and drug deaths, there's other data collections that have the potential, if we can move those forward, to give us more timely data on drug deaths and suicides. We are also doing a pilot in the Liverpool region where we are getting interim fact of death certificates from that region. So these are basically similar to what happened in Scotland. These are initial interim certificates issued before the death goes to a coroner, which would enable us to know about deaths before they go to the inquest. So we're piloting a piece of work there, but it's only on the Liverpool region. So we're seeing what information we can get there and whether that could be rolled out further to basically know about the deaths before they go to inquest and are registered. And that's specifically on the coroner's deaths are the issue for us, because they have the longer registration delay. So we don't know about them until the registration happens. So there's a lot of work going on, which we're hoping to move forward in the new year. But I think there was a specific question on the system in place. I don't think it's going to be possible for us to be able to move to a system like there is in Scotland easily.
So you say ONS is not really in a position to do that. Sheila, do you want to, I mean, you were raising most of those questions. Do you want to actually come in and make some comments, please? You're muted. You have to unmute yourself.
Sir Ian Diamond was working along with Professor Sir Chris Whitty to try to change things so that in England and Wales, and indeed Northern Ireland, but England and Wales primarily in the first instance, there would be registration of fact of death, as in Scotland, within 5 or 8 days of death having been ascertained. And that would move things forward enormously for the Office for National Statistics. We used to have a registrar general who was a professional statistician or a professional medic, and that's no longer the case. But it is fundamental to a competent state properly to register births and deaths. And we are not doing that in England and Wales, and haven't done so since the mid-1950s. There was a parting of the ways in England and Wales versus Scotland. Now, it's understandable back in the 1950s that people might say, well, there's a burden of having to have two registration steps, firstly for the fact of death and secondly for the cause of death. But in the computerized age, it is farcical that we cannot have those two steps. Now, I know the problem for the Office for National Statistics is that it apparently requires legislation, and getting a window for legislation is tricky. And I mean, the Royal Statistical Society has been campaigning for this change since 2010. This is not a new issue. And we've exhausted almost every other avenue short of actually doing the proper thing. It's terrific that ONS is doing nowcasting, which helps enormously, and it has moved to highlighting the registration delays. So ONS is doing everything that it can, but it needs legislation to unblock the registration of fact of death in a timely manner for England and Wales. And that, I think ONS in every talk needs to be saying that up front. Thank you.
So I mean, in terms of what needs to happen, I mean, ONS needs to lead on this, or I mean, what needs to happen to unblock this? I mean, legislation is needed, but a lot happens.
Yes,
Yeah.
there are three departments involved. Department of Health, because cause of death is important for the public health. The Office for National Statistics, and the Home Office, because the position of Registrar General is now with the Home Office, but is in general not held by somebody who has the professional background that historically a Registrar General would have had. So it is difficult to get three departments of state to get together, and often you need to find some legislation into which can be piggybacked this change of law. But it was certainly a high priority for Ian Diamond and Chris Whitty, and I hope that the incoming head of the Office for National Statistics will hold it as a very high priority. ONS is doing as much as it can, but its hands are tied behind its back until the politicians take action.
Yeah, thank you for that. Yes, obviously, as much support as we can give, I think, is the important thing to show. I mean, I suppose as statisticians, it's actually highlighting the difficulties that it causes by not having that system in place is really what our role can be, I think, isn't it?
Yes.
Yeah.
Yes.
Yeah.
Thank you.
Does anyone else, any other speakers want to comment on that? I mean, I think it's obviously fairly clear and understood that this is an issue that needs addressing.
I think Sheila summarised it very well, and I completely agree with what she said. I don't think we've ruled out the legislation change, but it's not going to happen quickly. So I think we definitely want to prioritise that, and the new incoming national statistician, we will get that on their radar and push that forward, but it's not going to happen quickly. So I think some of these other improvements and innovations that I've mentioned will be important going forward as well.
Yeah, thank you.
Yeah, thanks, Sheila.
I mean, Sheila, you raised a couple of other important issues or comments. I mean, drug-related deaths, and particularly you were saying that Scotland was sort of taking the lead on that. And I mean, then I'm sort of obviously interested whether then if Scotland have sort of taken the lead on improving that the other countries, as part of the theme group and the work that David's discussion, would actually be following on that. Is that?
Yes, I think it would help enormously if there were a national protocol for the conduct of toxicology and its reporting in England and Wales as in Scotland. I have to say, however, that to my knowledge, it's never been written up that there is a national protocol. I mean, the protocol itself hasn't been written up. But the important thing is that as new drugs of misuse are identified and so on, that protocol needs to be updated. And so the completeness of information that NRS or Office for National Statistics or NISRA has about substances is dependent upon what is happening in the field, in forensic autopsies and how they're conducting the toxicology. And so through perhaps the UK Advisory Group on Misuse of Drugs, a move to establish some sort of national protocol for England and Wales would, I think, help to give more granularity, if you like, to the drugs that are involved. But in England and Wales, as in Scotland, the major group is opioid-related deaths. And National Records for Scotland was the first in Europe to start focusing on analysis of opioid-related deaths by sex and age group in each year of those occurrences. And that's really important because different things are happening in opioid-related deaths and non-opioid-related deaths, of which a major component would be cocaine, but with new substances coming on board. So, a development, I'm not sure who should lead that. It would be of interest to the Office for National Statistics, but maybe it's in the UK Advisory Group on the Misuse of Drugs might be where you might hope there would be a recommendation on that coming.
Mm-hmm. Does one of the speak, David, or one of the speakers want to respond on that in terms of what's happening on the way forward?
I think so. I mentioned in my talk the early warning system that OHID have established on drug deaths, which is the main purpose really is to detect new substances coming in. This was definitely on their radar to look at how this is happening and whether there is a need for some more guidance on this. But I don't know where they got with that. So if you're okay, Sheila, I can put it to my colleagues in OHID who are leading on the collection of the toxicology data to see what they have done on this, and I can give you an update on that if that's okay.
That would be interesting. Yeah. Thank you.
Another point that you raised, Sheila, was around deaths in or soon after police custody, and whether are there any plans to report this, and obviously something about deaths in prison custody as well. So is that something that there are plans to do something on that?
I can comment on that one. So the recent report the Scottish Government did on deaths in prison custody, that was the first time they'd published that was, I think, earlier this year. So it is still in its sort of infancy of what they're planning to do with it. I don't know if there's any plans at looking at kind of wider, but I can certainly put the question to them to see if they've got an answer. But yeah, it is still a quite new report that they're in sort of developing as we go.
So it's sort of in development. Others could follow. So Sheila.
It's much more difficult to identify deaths that have occurred soon after police custody, and maybe record linkage would be required between dates of release from police custody and date of death, and that hasn't been done. So I don't think it's been done in the research setting, but NRS may be in a better position than anybody else because at least you know the dates of death. And again, the approach that's being taken in Liverpool, trying to do it in one area, for example, Glasgow or wherever, in the first instance, just to explore the potential. Because I don't think, deaths in prison custody in Scotland, fortunately, are typically fewer than 20 a year. And and are dealt with through fatal accident inquiries. But it's not clear that fatal accident inquiries would pick up deaths soon after release from police custody, and that could be a much larger group.
Yeah, I could say a bit about what ONS has done in this space. So deaths in prison custody, we have done a bit of work on. So MOJ actually publish a statistical series on deaths in prison custody. We can't easily identify deaths in prison custody from ONS data, but we have done a record level linkage to the MOJ data in the past, which did enable us to do some analysis of suicide and drug deaths in prisoners, which was quite useful. So we can do that again potentially if there is interest in that sort of work. So that's obviously positive. Your question on deaths soon after police custody is not something we've looked at, but I'm happy to take that away and see what could be done there.
It's hard, but I think potentially
we can't identify
important.
them obviously in the ONS data.
No.
Easily, unless there was a particular mention of that in maybe by a coroner as that being a factor in the death, but otherwise we need to do some kind of linkage to another data source to try and get to that information. But I have a think, and
in principle the ombudsman for prison and police in deaths in prison and soon after release should may be able to know about them, but I don't think the ombudsman has a way of identifying, deaths in the 4 weeks after prison release, let alone from police. So it's really a hard issue. It could be done for prisons in the 4 weeks following prison release, because there's a unique prisoner number and the linkage could happen. I'm not sure what would be required on the police side.
Yeah, it's a really interesting area to look at, actually. I can do some thinking, and if you want to have a follow-up chat in the new year on that, Sheila, I'm happy.
Very, very happy to. Very happy.
Another sort of question that a couple of people come up with is in terms of plans for moving to ICD-11 from ICD-10 to ICD-11. What is the situation about that? Does and sort of feedback on thoughts on that?
We're definitely going to move to ICD-11. We're not completely sure when we're going to. The latest I heard was 2027, but that may change. There's a whole team in ONS leading on ICD-11 and implementation. So if you want the details, I can get more for you. But yes, the short answer is we will move. But there's things to work through, like how this will impact the trend and the time series on certain causes of death that we're looking to work through, and do some like dual coding of deaths in ICD-10 and ICD-11 before we make the move, to check we're not going to create like a massive break in our time series. But yeah, if I can get more detail on the ICD-11 implementation, if that's of interest to whoever asked the question.
I think, it's of general interest. So, if you could give us the details, we can include it in the report that we post.
Yeah,
so that
I
would
can
be really
maybe
good.
a bit more detail, like a paragraph or something for the write-up.
Yeah. And if that's being brought on, will it be UK-wide implementation? Obviously, one hopes that's the case.
Yeah, so we sit, both NRS and NISRA sit on the group as well, with the team in ONS. So there's quite a lot of work going on. I guess timescales might be slightly different, but you would hope that we would try and implement it all at the same time.
Yes, we're getting nods from Northern Ireland as well, I guess. Yeah.
As we kind of have a provisional date of around January 2028, but obviously nothing's set in stone because anything can happen in that time, but that's kind of what we're going for at the minute.
Yeah, okay. There were some very specific questions that but whether or not that's easy to answer about, picking up on the slides, Sheila, you'd picked up on deaths registered having decreased, and you're not sure you know that. But I think unless that's easy for David to look at now, it's almost better to maybe come back in writing on, responding on that, I think.
I think with that,
So-
as Sheila's good point is basically we're talking about a 2.2% decrease in deaf registrations, not deaf occurrences, which is the whole point I've been talking about in the presentation, that it's a misleading picture to report deaf registrations. Ideally, if we had the system in place to report occurrences, that's what we would be doing. So you're right, it's not necessarily what will happen for deaf occurrences, and we have made a lot of effort, as I was saying in the presentation, to make it really clear in our bulletins we're talking about registrations. So yeah, I think that's a good point, Sheila. I think that was the purpose of that question.
Yeah.
And then there was a question sort of for the final presentation about a high level accuracy and what that actually means numerically.
Yes, so while we haven't done a test of the 95 confidence interval, when we have done our revision using ICD-10 codes as in comparison to our text search, in the year, we only see a difference of 1 or 2 for the entire year. So that leads us to be confident that what we're providing using the text search is accurate and as close to we can get with ICD-10 codes.
Great. Okay. Now I just sort of putting a few people on the spot here that actually had been given opportunities to attend this, in that whether they've got any comments or thoughts. And I know that Ruth Brown, who's actually clinical coding mortality lead, is that anything that you feel you want to query or pick up or comment on that? Because you're kind of coming at it from a different perspective. I mean, if not, you can still stay quiet, but I know we were sort of thinking that might be an interesting response in terms of the coding issues. I was going, if you just want to sort of stay quiet, that's fine, but
Sorry, could you repeat yourself? Sorry.
no, I said, I mean, Ruth Brown was actually clinical coding mortality lead. So basically, I was wondering whether there was anything that had been said or any queries from that perspective would be you wanted to raise with the speakers in this discussion. That was what I was raising, but if not, then we'll just sort of. So, are there any other? If anyone has got questions, they want to sort of put their hand up. I know we had some people who were saying they were interested in commenting, but they've all gone quiet now. Okay, so maybe if I just go around the oh, someone's mentioning the linkage of mortality data to cancer registries. Question just come in. You want to respond on that? Or maybe that's Sheila. No? Linkage of mortality data to cancer registries.
It's not something we've done, but obviously we're open to doing new data linkages. I guess the challenge for us is getting that data into the ONS can sometimes take time to do the linkage, but yeah, we haven't got it on our radar at the moment. But happy to explore it, Kevin, if it's something you think would be useful.
Right, yeah. Sheila, did you want to come back on that?
Just to say that it might be particularly useful in relation to alcohol-related deaths, because you may have liver cancer deaths coming through, and also esophageal cancer related to alcohol, which may or may not show up in your alcohol-specific deaths, which often are acute alcohol poisoning. So that there could, again, if you wanted to take it up in a specific area, then that sort of linkage might be of interest in expanding the work on alcohol.
Yeah, it's really useful. Yeah, something to definitely look at. Thank you.
And I see that Kevin's come back with a comment in the chat about the reporting on mesothelioma mortality, and there are more registrations than deaths. Maybe that's something that could be taken up discussion outside this, if that's of interest. Yeah. So maybe just go back around with the speakers again, as having now heard all of this and heard what the others say, in terms of what do you think are the sort of the key issues that's really important to take forward? There's obviously not, you've talked about reporting, but obviously things in development. So where would you like to see things going, or where do you think it's important to focus over the next, as the new year is coming up, in terms of mortality statistics? Sort of going around, maybe Beth, it's always interesting that Scotland is able to do things that others can't, and then maybe others can follow.
Yeah, absolutely. I think being a smaller nation definitely makes some of that a bit easier. Yeah, I think certainly the ICD-11 is probably the big thing for all of us, that also with the kind of implementation of that we'll be reviewing how we define, an alcohol death, suicide death, all these different definitions. Is maybe an opportunity to try and improve the coherence even more than we already currently do. Yeah, just having that sort of opportunity to review everything that we produce and try and align where we can is hopefully something we can do down the line.
So Rachel and Suzanne, for Northern Ireland, what's your, it's always challenging for you, because you're sort of trying to do everything everyone else does, but you're a very small country with limited resources. So where do you see things going? What are your main challenges, or what you hope to achieve?
We have spent quite a lot of time there trying to get the homeless deaths report, because that was our first one that went out today. So that was to try and kind of stay in line with NRS and ONS. I think for future publications, as Beth said, just trying to, stay in line with definitions, and the mortality theme group that we attend would definitely be really beneficial to maybe focus on different, outputs that we're putting out, and trying to see if there's anything that we're missing that maybe we could include in future ones. So there's definitely a good lot of things that we can discuss and maybe make some changes going forward.
David?
Yeah, I think we've covered a lot of the ONS priorities. I think obviously the main one we've spoken about is our communication of registrations and occurrences, and some of the improvement work we're doing there. We really want to move that forward in the new year. So that's our kind of top priority, I think, at the moment. But yeah, I think there's scope, as Rachel kind of hinted at, to do a bit more collaboration, I guess, between ONS, NISRA, and NRS on maybe specific causes of death, like suicides, drug deaths, homeless deaths, and really get down for users how comparable those statistics are across the three organisations, and get that out there to users in a succinct way could be useful. I think we've done that for drug deaths with the blog that I mentioned, for example. We're working on something for weekly deaths as part of that theme group, but there may be more we can do for some of the other causes of death. So that could be a priority for the theme group in the new year.
Now, putting people on the spot again, I noticed Cher Cartwright, you put some comments in the chat, but you did also mention in emails that things that you were going to publish some reports next year. Do you want to actually say anything about that, to share what you're planning to do?
So yeah, we published the excess mortality for SMI for mental health, and we're looking at the moment suicide rates. So looking at sort of mortality by suicide, and then where somebody's been known to services and things like that before that point. And so it's great to see how you're we've got the same issue because it is suicide. We've obviously got very late registrations, and how you're handling, and that's obviously seems to have got worse since COVID and the delays. So it's impacting some of our reports. So it's nice to see how you're kind of handling that, and you know, gives us thought, because we were looking at whether we go occurrence rather than sort of registrations, to be able to be looking at that analysis. So very helpful.
Great, thanks. So are you actually sort of liaising with David and his team on this, or is this?
No, we haven't. We're talking with OID though on their real-time surveillance. So it's a joint project with OHID at the moment. But yeah, I might come and talk to you, David.
Yeah, that sounds
Right.
good. Yeah, thank you.
Good, thanks. So it's always good to make the connections there. Yeah. Okay. Anything else anyone wants to pick up? We're sort of coming to the last sort of 4 or 5 minutes, and just sort of say again that, you know, we will be doing a report of this, and then also an opportunity for people to respond and add further comments on that report if the speakers have other things they want to say. Sheila, is there any final thoughts that you might want to have in terms of what people are taking forward?
No, I was just typing a thank you to the speakers for really an excellently informative session.
Oh, that's good. Yeah, yes. Thank you very much to them. That was really good. And I say this will be posted. If people got other comments, we can continue the discussions via the websites and either of those websites. That will be very helpful. If there's no other questions, I think probably we've only got a few minutes to go, so I think I will draw that to a close, and look forward to further comments and discussions via the website or via email. I think there's some connections here and things to move forward with. So thank you very much to all the speakers and all the contributors.